everybody, and welcome to today's webinar on HR legislation updates for 2022. My name is Christelle Wren, and I'm the COO here at HRLocker. We're delighted to have Jennifer Patton with us today from Bright Contracts. So Jennifer, thank you so much for being with us today.
Thank you very much for having me.
Looking forward to hearing all your updates, and we have a great audience today. So for those of you who haven't been on our webinars before, I have the lovely Jenny Martin with me today, who will be manning the questions and answers section. So if at any time that you guys have any questions, or you want to ask myself or Jennifer any questions at all, please just put in put in a question into the chat box, and we'd be happy to answer any of your questions that you have. So I suppose what we'll go through first, Jennifer, I'm just going into the next slide. We'll just go through the agenda first for today. So the things that we'll be going through is the additions to parents' leave and adoptive leave. We'll be going through the remote working policy updates, as well as the workplace updates. So the different kinds of, once we return to the workplace, the hybrid working or remote working, anything, the return to work protocol, the pause and redundancies that has been lifted, as well as the future HR updates for 2022. And then we'll go through a bit of the budget 2022 updates as well. Jennifer will also be going through the updates that came yesterday from Leo Varadkar in terms of the requesting the right to request remote working, so we'll go through a bit of what was said last night as well for you, and what updates you should be considering at this stage. And then we have a number of downloads as well that Jenny will send out at the end of the webinar for you guys. And as always, if you have any questions, we'd be delighted to go through anything with you. We'll answer as many questions as we can throughout the webinar. But if there are any more kind of specific questions, myself and Jennifer can take them offline with you guys. Okay, so we're just going to pop into the next section here. The first thing that we're going to look at is the additions to the parents' leave and adoptive leave. So this was introduced last year. It's important that you're updating your handbook in regards to the updated Family Leave and Miscellaneous Provisions Act 2021. So what has been updated here is that parents have an additional 3 weeks. So they have 5 weeks parents' leave, and as well as that has to be taken within 24 months of a child's second birth, or within the 2 years following adoption. One of the key updates here is that between an adopted couple, that this can be shared between male or female, and obviously same-sex couples as well, so they can choose one person to take that leave. So paternity leave benefit will also be made available to the parent who is not taking the adoption leave as well. So the employers, as employers, you should be updating your family leave policies to reflect this most recent change in the parents' leave and adoptive leave, and also capture the increase, really, I suppose, that came into effect in September 2020. As well as that, I suppose, just really to note as well that we are very much looking at a parent's, I suppose the government is looking at the work-life balance directive that the EU have been put in. They have to put it in place by August 22, and it is really concentrating on that flexible working for parents and looking at the protection of the family in the workplace as well. Something to consider when you're putting in your family leave policy. So if I just pop onto the next slide there, and Jennifer, if you want to go through the remote working policy updates.
Thank you very much, Christelle. Good morning, everyone. Thank you very much for attending today's webinar. As Christelle said, I'll be taking you through the remote working policy updates. And the first of these is the right to disconnect. So as part of the government strategy to ensure that remote working is a permanent feature in the workplace, the Department of Enterprise, Trade and Employment, they committed to introducing in the first quarter of last year a new code of practice on the right to disconnect from work outside normal working hours. I think we all know that when we all went to working from home, we tended to kind of work later than we usually would, and we found it hard to disconnect. So this code of practice came in, and as promised, the Code of Practice came into effect from the 1st of April 2021. And really the aim of this code was just to encourage employers to create a culture of a good work-life balance, where you break bad habits, where people feel obliged to respond to message out of hours, which is easily done. I think we're all guilty of that. And crucially, the code refers to a right to maintain clear boundaries between work and leisure time, which is crucial. So the code defines the right to disconnect as having three main elements. The first is a right not to work routinely outside normal working hours. The second is a right not to be penalised for refusing work outside normal working hours. And the third is a duty to respect another employee's right to disconnect, which is vitally important, just because if let's say, for example, I'm working late, I can't assume that all of my other colleagues on my team are as well. So just maintaining that respect that another employee has that right to disconnect outside of their normal working hours as well. But it should be noted that codes of practice in Ireland are not actually legally binding of themselves, but they can be used in evidence, against employers in claims for breach of employment rights. So that's just important to bear in mind. So it is highly recommended that employers can show that they are actively following this code and by implementing a right to disconnect policy within their organisation. If by contracts, we would have published a right to disconnect policy last year as well. So we have that in our software, and our customers have distributed that to their employees. So in establishing a right to disconnect, the code does recognise, however, that each workplace and employment is different. There's no one size fits all, and that different considerations do need to be taken into account. So, for example, from an employer perspective, they must still be able to meet their obligations. So in terms of the service being provided, the employee's role, the needs of customers or clients, the unique requirements of critical services, and what was agreed in an employee's terms of employment. So Christelle, if we could just move to the next slide there, please. Perfect. So with the code, there isn't just obligations on the employer. There is obviously obligations on the employee as well. And the code does highlight that employees have a responsibility as well. So it does recognise that this does solely lie with the employer. So as an employee, you have an obligation to ensure that they manage their own working time, which is really critical. They must cooperate with their employer to take care of their own health and safety. They must cooperate with any systems used to record working time when working remotely. Some companies might do this through timesheets, for example. They must be mindful of their colleagues' right to disconnect, as we mentioned previously, and notify their employer of any rest breaks that they could not take. But they also must be conscious of their working patterns as well. So working crazy hours while they think themselves that seems like a good idea at the time, in reality, it's not really good for your own health and safety as well. So you have that obligation to make sure that you're getting those rest breaks and that you're not working extremely long and crazy hours. So I think there really is a fairness to the code, both to the employer and the employee, and it takes into consideration both sides, which sometimes I find with Bright contracts, sometimes we do get calls from customers that they think that certain policies seem to be more in favour of the employer over the employee, and that can be seen in some of them. But I do find that with this code that they really have taken the time to think of both sides of the coin, which is vitally important. So I'll pass you back to Christelle.
Thanks, Jennifer. I'm just going to pop over to the next slide there. And I think that's key thing to remember there, Jennifer, isn't it, in terms of that there is a shared obligation there. It isn't purely just for the employer to have that obligation. The employee needs to make sure that they're minding their own mental health as well and that work-life balance. It's difficult to be able to put in all the right procedures, and then you have an employee who's working 50 or 60 hours a week. It's something that you have to take joint responsibility for. So when we pop over to the next slide, and I think that specifically with the announcements in regards to to the beginning of the week where the restrictions are leaving, and now we really need to be looking at, well, what do our workplaces actually need to look like? And I think it's important that regardless of the government legislation, that as companies you need to decide, well, what does your workplace look like? Are we looking at a remote first workplace in that we that we have remote workers majority? We look at that office occasional, which is kind of that hybrid working model, or office first in that we need to have people in the office. So we have a number of different downloads in regards to the hybrid work model, and I know that you have some as well, Jennifer, for that in Bright contracts. But it's important at this stage that we are looking at deciding what way our company wants to look like. So a couple of things to consider when you're deciding, I suppose, what does your workplace want to look like? You need to look at really what's best for your organization, and communicate what your expectations are. In regards to, we have to be mindful of the fact that even though the announcements were made last week now in regard that the workplaces are open, and basically you can invite everybody back into the office, we have to be mindful of the fact that a lot of people would have changed the arrangements that they had 2 years ago. So they may no longer have childcare, they may have moved, they may no longer have transport. And so that's something that, in terms of when you're communicating your intentions, you have to be able to say, we're putting in a hybrid working model, so we expect you here on Thursday, Friday, or whatever it is. And you need to be able to communicate that and discuss with your employees really about what way you can work effectively together. Jennifer's going to go through the right to request remote working, and I think that the key to that is that it's the right to request. It's not a fundamental right for an employee, but it is important that as an employer you're considering what works best for you as a company and what works best for your employees. Then at this stage, we're kind of somewhat out of that forced remote working in terms of the government legislation. So at this stage, if you are looking at doing a permanent hybrid working policy or a permanent remote first working policy, you should be looking at the written agreements that you have with your employees. So you should be looking at if their place of work has permanently changed, you should be looking at updating their contracts. And then, as well as that, if you're looking at putting in that flexible working model, what does that look like for your company? So you need to be putting some policies and procedures in place for that. And then, unfortunately, where we are at the moment is that even though the remote working advice has gone, we still have to look back at our COVID-19 response plan. So, as a company, when you're opening your doors in regards to your office, what are you putting in place in regards to hybrid working? Are you now have a full office? Have you taken some desks out? That kind of thing as well. But I think at this stage, it is important in terms of communication and important to be looking at your policies and procedures. It doesn't have to be a laborious task. We have a lot of policies and procedures on the website that you can download in regards to flexible working and hybrid working. Jennifer, I know that you guys have a lot in Bright contracts as well. And we with ourselves, we just communicate them through our own internal system to be looking at those digital signatures and things like that. But I think, Jennifer, you'd agree that the number one thing is communicating with your employees what your workplace is going to look like.
Yes, exactly. So Christelle's right. So obviously everyone would have seen the announcement for the restrictions being lifted, and this obviously meant that there is a change to the COVID response plan. But what Christelle has gone through there, that's still extremely valid. The government haven't actually given any specifics as to what businesses can do now as to whether, okay, you can stop wearing masks or it is okay to stop social distancing. It hasn't been defined yet. It is expected that it will be released hopefully over the next coming few days or hopefully the start of next week. So everything that Christelle has gone through there is still extremely important for employers, and especially keeping that line of communication with your employees. So obviously prior to that announcement, the advice was that everyone worked from home, and our advice to our customers would have been to have an open conversation with your employees to see, does working from home work for you? Because it didn't work for everybody. And the same as anything, it's not one size fits all. And for some people, they really hated having to go back to that hybrid working. It just wasn't great for their mental health, or it just wasn't possible to facilitate it at home. So we came up with a hybrid working template that for employers and employees who came together and made a hybrid working plan for that employee. It's always important to have it in writing, not only for the employer, but for the employee as well, to see what the expectations are of them. And so, for example, you might have in your hybrid working template that they come in 3 days to the office and spend 2 days at home. But it does also still need to detail that all of the terms and conditions of their employment, while they may not be in the office, they still apply at home. So it's really important to make sure that you have these written agreements with your employees who are facilitating a hybrid working, just to make sure that everybody knows where they stand on their duties and their responsibilities. And so what is on the screen here is an example of a hybrid working template that Bright Contracts created. And we have it that it's completely downloadable and you can edit it. It's in Word, so it's completely editable to whatever plans suit you and your employees. And as we'll discuss when we move on to obviously the recent news from Leo Varadkar, it is important to have your hybrid working policy as well. So having those two documents to coincide with each other is really important. But I'll discuss that a bit further on when we move on to the right to request remote working.
Thanks, Jennifer. I'm just going to look at some of the questions here now. So the first question, Jennifer, that we have here is, what if an employee is refusing to return to work as their doctor says they're only fit to work from home?
So it's really the same as kind of before. It is really going to be a case by case basis. For any employer, especially if you're looking at, some companies will be looking at, they want to bring their employees back 5 days a week. But the way that we see it is that you would really need to have strong reasons as to why you need an employee to come back to work 5 days a week. And if it's that their role isn't possible to be carried out at home, or if it makes it hard to kind of divide out the work amongst other employees, those are kind of justifications that you can use. But when it comes down to the employee's health and safety, if it has been recommended by their doctor and they have a certificate to reinforce that, you really would have to basically kind of, I suppose, adhere to that, really, because what they're saying is that due to their health that they can't come into the office. Now, I don't know if it's that they can't come into the office at all. But what I would suggest is having, as I said, that open communication with that employee, seeing what the reasons are. And obviously, if they're personal and that they wouldn't like to discuss, and that's their prerogative, you can't push them to tell you. But if it's for some employees, it might just be that they have that fear of coming back into the office, which I'm sure an awful lot of people have. So having that open communication with employees and is still implementing to them that, okay, we still might have social distancing in place, which some businesses do, and some are making it that mask wearing as well is still a thing, or it's personal choice. So I suppose just communicating to the employee, yes, restrictions may have lifted, but we still have these things in place in our office that still make it safe. We still have cleaning that goes on so many times a day and so many days a week. So just having that open communication, and if it is something that it is due to their health and they have their doctor's note, unfortunately, there wouldn't be anything that you could, there's no real wiggle room there, so to speak.
Yeah, and I think that that's important, is to really just have the conversation, right? To make sure that,
Exactly.
that you understand, and to have that honest conversation as well in regards to, can the work still be done, and I think that that's the key. I'm going to ask this question, Jennifer, but we might leave a little bit to the chat at the end. Is that, so in prime time last night, they were discussing remote working. A legal person on there was saying health and safety is going to be an issue in regards to employees working from home, in regards to their health insurance, and possibly employers would have to make a change as well. So what are your thoughts about this? I know we did a podcast on this actually a couple of months ago. We do have actually a health and safety document downloaded for employees to be able to that you're, as an employer, you should give out to your employees in regards to their health and safety at home to make sure that they don't have any exposed cables and things like that. There was recently a case about this in Germany as well, that somebody fell down the stairs, and Jennifer, they won, the employee won. So I do think that I think that this is a space that is going to be highlighted more and more in the next few months. Personally, Jennifer, what do you think?
Yeah, I think you're right, and I would have been surprised actually about that recent case now in Germany. That is surprising. Yeah. But I agree with Christelle. Like, what our advice was when everyone was going working from home is that employers carry out risk assessments with those at home. As Christelle said, to make sure that there's no exposed cables, to make sure that they have appropriate equipment to carry out their role at home. So a good desk, chair, whether it's a monitor that they need, things like that. Making sure that they have the necessities that they need to make their home office, so to speak, as safe as it will be as if they were to be in the office. So there is still that duty of care naturally on the employer to protect their employee when they're at home from risks. So carrying out those risk assessments is really key. If it was a case that you carried out those risk assessments with an employee and it was found that it was a safe working environment, and then obviously something happened, like for instance that something similar enough to that, it will be a case where obviously a reassessment would need to take place. It is extremely difficult to kind of pinpoint exactly what will be the answer to those kind of situations, because the same as anything, it really is a case by case basis, and it depends on the details of a health and safety accident at home. But having those risk assessments, I would say, is absolutely key for every employer to have carried out with every employee. And if employers haven't done it with employees and their employees who are going to continue to work from home, I'd absolutely make sure that you conduct those straight away. And they're available on the HSA website very easily as well. And they have ones for the office as well. So they have sufficient ones up there as well that people can use. So they're easily accessible.
And I think that's really covering your duty of care. I do think, unfortunately, we're going to have to wait for kind of legislation on that in regards to the health and safety. Where does the employer and the employee's obligations kind of cross over, or where do they stop?
Exactly.
But I definitely think at the moment it is something that will have to be addressed, because I think, personally, I think the employee has to have some personal responsibility there. But your risk assessment's really important. Jennifer, a great place is the HSA website. And then Jenny, if we might include that risk assessment as well for people in the follow-up email as well. I'm just going to take one more question and then we'll move on to the next side of it, Jennifer, is from a health and safety information GDPR standpoint, the employee's workspace may not be compliant. What are the employer's obligation here? So Jennifer, what I would say is that if an employee, so obviously from a company perspective, your GDPR legislation is very important, and if an employee is not able to comply with that, then that means that their place that they work from home or their remote working is not a suitable location. So we would have that when we are employing people, and all our employees, they do have to go through that risk assessment, but they also have to go through in terms of security check of their bandwidth and their Wi-Fi and things like that. So I suppose it is something that is probably required for them to be able to do their job, and maybe that's that they don't work from home, maybe they work from a hub instead, or maybe they have to come to the office because they can't provide a secure location. Jennifer, what are your thoughts?
Yeah, exactly. That's completely correct. And that was actually one of the reasons that Leo gave in that recent update on why an employer can refuse a request to work from home, is if there is a breach of GDPR and privacy by you working at home. As we all know, like, cyber attacks has been a huge thing over the past 2 years. And when you're in the office, I suppose you have everything readily available to you. You have the IT person on hand if your computer gets hacked, things like that. Whereas when you're at home, you really are exposed, and it can be very easy for things to happen. So as you mentioned, if it is a case that their home space isn't ideal for being able to keep up that GDPR and the privacy. That is a huge thing for employers to consider, and that will be where they can say, okay, unfortunately we can't have you work from home from home anymore. You will need to come back into the office. And Leo Varadkar said that that is a justification for being able to refuse a right to work remotely. And so that is what is hopefully going to be in that bill when that comes in. So that will be listed there, which is great that we'll have that guidance. Because as we mentioned there isn't specific guidance around the health and safety from home, but things like that, which are slowly coming in, is great and gives great guidance not only to us as HR professionals, but also for us to give to employers. So it's great to know that that is something that will be transposed into the bill as to why you can lawfully deny a request to work from home.
Yeah. Now we have a number of questions. I'm going to get everybody's questions, but I'm going to keep going with the slides and then we'll get to those questions at the end, if that's okay. So I'll pop over, and this is sometimes when we see this vaccination site, Jennifer, everybody's like, no.
I know, it's still such a touchy subject, I think, and I always find that we've spoken out about the vaccine and stuff before because it is a bit of a grey area still. So we have had an awful lot of questions from people, which is why we're doing this as a Q&A type section, which I think covers all the questions that people might have about the vaccine or having a vaccine policy. But basically, when it comes to the vaccinations, the main question that we have been asked is, can you insist that an employee be tested? Now, in Ireland, there is an absence of a legal requirement for employees to take a test. So no individual can lawfully be forced to take one. And actually, if someone was forced to take one, it can actually be considered assault, given the physical element of taking a test. So it's really important for employees to bear that in mind. And employees who have no symptoms, they should only really be asked to take a test on a voluntary basis. The same as taking the vaccine, going for a test is completely voluntary. And so employees who have no symptoms, and if they're not a close contact of a confirmed case of COVID-19, then there may be a query around the legal basis of being required to take a COVID test before entering a workplace. And in this scenario, the purpose of the test should be explained to the employee. And if the employee continues to refuse to take a test, then employers really need to tread very carefully to avoid any employee relations issues. So that's really key there. And then obviously now we have employees who are either only taking up the initial vaccines or they're getting their boosters. So an awful lot of employers have been asking us, can I ask an employee if they have been vaccinated? Which has been a common question over the last while, and I suppose it's a question that most probably wouldn't expect this kind of answer, but employees are actually not obliged to provide their medical information, but employers may seek vaccination information on the basis that they're meeting their legal obligations under the Safety, Health and Welfare Works Acts. Now, it will be completely up to the employee if they wish to volunteer this information to their employer, and if they do volunteer it, employers shouldn't disclose this information to other employees, because this medical information, the same as other employee-related information, falls under the sensitive category of personal data, which under GDPR there are additional protections afforded to the processing of this information. Then another question that we have been asked is, can employees be can they be asked to take a vaccination? So currently vaccinations are only recommended by Irish authorities. We've obviously seen across the news there's some countries who have brought in compulsory vaccination, but as it stands in Ireland, we are still on a voluntary basis, so they aren't compulsory. But even with the rollout of the COVID vaccination amongst medical workers, employees of the HSE, it actually wasn't mandatory for them to get it initially, which I know seems so bizarre. But with this in mind, it is going to be very difficult for an employer to argue and even defend a case that vaccination is compulsory in a workplace. Now, there may be some exceptions, but they will likely come through a court proceeding. So in relation to actually trying to enforce it in your organization, my advice will be to deter from that, because in relation to any employee relations issues, it is going to cause that hassle for employers. So it is really up to the employee if they would like to take up the vaccine, and that's how it seems to be standing at the moment. So as to whether that will change, obviously that advice there will change, but as it stands at the moment, no, they can't be forced to be vaccinated.
And actually I have two questions here which I think we can answer quite quickly. Jennifer is, can I insist that anyone working from the office is vaccinated to protect every other employee, but not risk the employees directly, which the answer really is no, right?
Yeah, basically the answer really is no. And I understand the angle that the person answered that question has come from, is that it is from a health and safety perspective, but really it still is no. In the absence of any legal requirements from the Irish government, you still can't force them to be vaccinated in order to enter an office, and that would also extend to that you can't let go employees that won't get vaccinated and therefore can't come to work. There's also no guidelines around that, so that's something that also can't be done. So the answer to that question, unfortunately, will be no.
Yeah, and then this is actually an interesting one, and again, I think this is going to be a difficult one to manage when we're bringing back people to the workforce, the workplace rather, is based on the new close contact rules, which I think they're changing every 5 minutes. But based on what we know today, could the sick leave policy be amended that certain staff not covered because they're, some people will be vaccinated and boosted. Close contacts can attend work, but I mean, it's quite a minefield in terms of if you're not vaccinated, you look at the close contacts, but if you are vaccinated and boosted, then you're not. So, I mean, I think at this stage, Jennifer, I would say in your sick leave policies, you're linking to what the government is saying, because it can change next month, basically.
Yeah, exactly. Like when it comes to that kind of thing, I think we're right. We wake up one day and it's one way, and then 2 days later it can change. And then obviously the sick leave bill is something that is meant to be coming in, and I suppose everyone was hoping that there'd be a bit more definition around that kind of topic as well in there. And it was meant to be that it would be here early this year, but the Irish government not being on top of things. Yeah, we're still waiting. Hopefully not for too long. But yeah, basically, for employers, really, when it comes to that kind of thing, it would be that they just need to define, I suppose, what they think is best for their business and their employees in their policy. Again, there isn't any specifics from the Irish government around how such a thing should be carried out. So really, it would be up to your lead worker representative and the overall employer to kind of come together and assess, okay, how can we keep our employees safe? What way will we now look at our sick leave policy based on the current government guidance? A lot of it is just having to follow the government guidelines, but unfortunately it is difficult because it is changing as quick as the weather. So yeah, you'd be changing your policies all the time. But I suppose the hope is that now what has come in now will hopefully remain, and then employers can look at their sick leave policies again and have that defined not only for the employees but for their managers as well, because this is going to be a headache for them as well. Sick leave has been a huge increase over the last year, with obviously everyone contracting COVID and being close cases, etc. So it has been a hard thing to manage and hasn't been easy for any business. So it will be good to have that clarification when the sick leave bill comes in. But as it stands, it would just be following the government guidelines and implementing that into your sick leave policies.
Yeah. And then the next question, which we'll do the last one, Jennifer, and we'll go to the next slide then, is what can you say regarding the unvaccinated employees? Will they be protected from discrimination and exclusion in the work environment? So as it stands now is that you cannot treat a vaccinated or an unvaccinated person any differently. And that's, so in terms of protection, there isn't specific protection for unvaccinated people, but it's the same protection for all your employees, that regardless of if they're vaccinated or unvaccinated, all employees need to be treated the same.
Exactly. Yeah, I completely agree. And that extension, as I said before, just because if one of your employees isn't vaccinated, it doesn't mean that you can use that as grounds for dismissal. Every employee is the same. All of their rights are still the same, whether they're vaccinated or unvaccinated or not. They're still the exact same. And so there'll be no difference in treatment there.
Yeah. So we'll pop on to the next slide.
Perfect. So this was basically in relation to what the employer can do in relation to the vaccine. So employers should still continue to promote that their employees take a vaccine. And the best way to take a proactive stance, in our opinion here, is to roll out a vaccine policy. And we would have advised to our customers in doing this when the vaccine rollout was first happening, to help prepare employees. So in creating a vaccine policy, you'll want to consider 5 things. And the first is that you must provide your workplace with a list of resources where they can obtain further information about the vaccination programme. So that would be gov.ie and hse.ie. And then your policy must recognise that the decision to avail of the vaccine is the individual's choice, but that the employer encourages their workforce to make an informed decision by reading information about COVID vaccinations, but from official sources, and listening to information the HSE provides when offering a vaccine, and then obviously being cautious of misinformation around COVID-19 vaccinations. There has been many unreliable sources over the past year. And unfortunately, people have been have fallen for that false information. So just making sure that you're cautious of where you get your information from, that you only get it from official sources. Then you must detail whether your employees will be paid or unpaid for the leave to attend their appointment, which has been a common question from our customers. Again, there is no legal requirement to be paid for it. Our recommendation would be that employees do get paid for it. It's obviously not something. It's something that they're doing not only to protect themselves, but also to protect their employees and basically to protect Ireland as a whole. So they shouldn't be basically put out for that. So we would always recommend that employees be paid for that, but that is obviously up to the employer as to whether they do that or not. Then they must also state that if an employee feels unwell after their vaccination, and that they'll be instructed to follow the company's regular sick leave policy, and so that needs to be laid out there. And then lastly, employees must remain responsible and respectful when conversing with their co-workers about vaccinations. So as we mentioned there, and there are some people who haven't taken up vaccinations, and that's their personal choice, and for whatever their personal reasons may be, that is no other employee's personal business to discuss with anybody else. The reasons as to why an employee does or doesn't get vaccinated, that is completely their business, and it's not up for discussion by anyone that you are working with in the workplace. So it's just important to maintain that sense of privacy as well. And then, Christelle, if you move on to the next slide, this is just a quick snippet which shows kind of what our vaccine policy entails. As I mentioned, employers should promote that their employees take a vaccine with a vaccine policy, but your vaccine policy can't obviously state that it is a requirement of your employment, and that is not something that can be put into your vaccine policy. So we have that available in our software like our other policies, and employers can choose to edit specific sections of it as well. Everything is entirely editable, so if there was anything extra that they wanted to put into their vaccine policy that they felt was relevant, because every industry is different, that can obviously be added in as well. And so I'll pass it back to you.
Super. So there's 2 questions here, and I think we're one of these, and I actually have brought this up myself because I'm going to unfortunately not give you a clear guidance. This is, if an employee doesn't want to share the information revaccination or boosters, how do you implement your sick leave policies if you're not supposed to ask or know? And it's actually something I brought up when I saw in terms of the now with the close contact rule and the isolating and not isolating, if you're vaccinated or not vaccinated or boosted, is that then as an employer, you need to be able to know if they're vaccinated, which is a little bit grey at the moment, Jennifer, right?
Yeah, extremely grey. Because as I mentioned, like they aren't obliged to provide that personal information, and you do have to have a strong reason as to why you're looking for that information. Like for example, if you are working in a care home, for example, you're obviously looking after extremely vulnerable people, and therefore you'd need to know the vaccination status of your care workers. And so there, obviously, that's black and
that's
white. It's
covered
very,
under, yeah, that's covered under the
exactly.
Data Protection Commissioner at the moment.
Exactly. So that's very clear there. But I do understand it is extremely grey in other businesses where there isn't such a clean cut scenario there. But depending on what the industry is and what type of job the employee is doing, you'd have to assess that, and then from that, then state, okay, we need to know your medical information as you carry out this role, which deals with such people who are vulnerable or etc. So it's just, you'd have to look at each employee's role who you're looking to get the vaccination data from, and assess the need to know the vaccination status, and that would have to be communicated to your employee. So having that communication with them as to why it is necessary and to be communicated to them is going to be vital there.
Yeah, and I think just to be clear, the guidelines that we're working off at the moment is what the Data Protection Commissioner has said, is that if you are a frontline healthcare worker, your company can, that information in regards to vaccination, your company can ask you that. And that's it. Everything else is covered under the sensitive information side of it. So I would totally agree with that person who's asked that question, is that it does get a little bit grey then when with the sick leave, but that is the guidance that we're looking at the moment. The next question then, and we'll go on to the next slide then, Jennifer, is as part of the working from home policy, can we request that all employees who are not vaccinated remain working from home? And no, really, is it to that, because we don't discriminate against vaccinated and unvaccinated?
Yes, exactly. And we have had that question before, and you're absolutely right. No, that would be discriminating against them, saying, well, you don't have your vaccine, so you can't come into the office. And as we said, every employee is the exact same, whether their vaccination status, no matter what their vaccination status is, pardon. So the answer to that would be no.
Yeah, exactly. And then sorry, I know I said that was the last question, but I'm going to answer this, is that if both vaccinated and non-vaccinated can transmit the virus, is it necessary to know vaccination status? And so that's exactly it. Is right now the advice that we are working on is that unless it's a healthcare provider, unless you're a frontline healthcare worker, it's information that you can request. Other than that, you just can't request it. And so that's the that's really I suppose. And sorry, what if you provide accommodation in relation to job with other employees? Can you request them to be vaccinated? No. Basically, that's the thing around vaccination, is that you can't request people to be vaccinated. You can't ask their vaccination status unless they're frontline healthcare workers, and that's the current guidelines at the moment, which I totally do understand, and that some people maybe want to know in terms of the office, but you know, that's kind of really the guidelines that we're working on at the moment. So the next section I'm going to look at is the return to work protocol. Now, again, I'm going to preface this with that these are the current guidelines that we are working on, because they haven't been updated yet. But there are certainly things that I can see in the current return to work protocol that are going to be updated in the next few days, hopefully. And once they are updated, we'll send an update to you guys that you guys can work off. But the clear thing that I would see that will need to be updated, Jennifer, would you agree, is that, you know, the social distancing has now been removed. So currently in the return to work protocol, it does say still social distancing and that 2-meter rule, which has in effect had people maybe half their office space. So we are expecting some kind of change to that in the return to work protocol going forward. But currently, right now, as it stands, that this is still what you should be working off of. So the first thing is that there should be a lead worker representative in terms of that return to work, whether that's your health and safety person or your HR person. And there is risk assessment and health and safety policies. So a lot of the things that came from the return to work, I think that we shouldn't just be throwing out the window because, you know, we've now been, you know, that we're okay to go forward. A lot of the things were really good to keep with. So, you know, your hand sanitizers, your your ventilation in the workplace, your cleaning policies and things like that. So rather than just throwing everything out that came with the return to work protocol, I would suggest that once it's updated, that you review things that you think you might keep going forward. But right now, you still have to have that risk assessment of a health and safety policy. You still need to have a COVID-19 response plan. So basically, if somebody tests positive in the middle of the workday, what are you going to do with that person? You still have to have a plan. People still need to be completing the pre-return to work forms. If that continues or not in the new update, we're yet to be told. And as well as that induction training for all staff. So once you open your workplace up again, if somebody's coming into the office, you need to do that induction training in regards to here's your hand sanitizers, just good health and safety and hygiene. And then keeping that right now, you are still supposed to be keeping that contact tracing log, but I would expect that would change in regards to in the next couple of weeks as well, and review your other company policies. So we're still working off the return to work protocol was last updated at the beginning of the year. But we would expect that some aspects of it will change over the next coming days. Jennifer, do you have anything to add on that?
No, just to say there that just to reiterate everything that you have said there, everything is still extremely important. And actually, in relation to the pre-return to work forms, the HSA actually only updated their website 6 days ago to show that those documents are still as important to help prevent the spread of COVID-19. And then obviously, if you have employees who have had COVID and were obviously at home sick and then want to come back to the office, you still have to fill in those forms. I think for an awful lot of employers, or even employees as well, when they heard the news of restrictions being lifted, it was like, woohoo, everything can go out the window. But it's honestly not the case. It's still important to have your lead worker representatives to make sure that they're trained, which the HSA still has their course online to do. Reviewing your risk assessments and health and safety policies, that's a regular thing.
Yeah.
It's probably been the most reviewed as well over the last few months as well, but that's always going to be ever important. And still having your other company policies reviewed. So again, your sick leave policies, and also still having, in my opinion, I still think COVID-19 induction training should still be done for all staff, because you still have your isolation areas. They still need to know what to do if someone is a close contact or if someone is positive for COVID-19. All those things are still so important, because as a new employee coming into a business, if this is going to be the first time that you've worked, let's say maybe since COVID, they don't know what implementations have been put in businesses around those kinds of things. So it's still important to inform them about all of this. So I still think that having that induction training for your incoming staff is still going to be as ever important as it was before. So everything that we have mentioned here at the moment is still what it is. Still what the guidance is. I don't think that much will change in the coming weeks. I think they'll still be reiterating the same as us, that all of those things are still ever important, because the virus hasn't disappeared. So we all need to still make sure that we're taking those measures to still keep protecting our employers and employees. So it's still very relevant.
Yeah, and I think it's actually, if anybody has a couple of minutes to sit down and read the whole document, but it actually is, the advice in the document isn't, it's not altogether crazy. It's some of it's very good, some of it's some things that we should be doing all the time. Like you said, Jennifer, we should be reviewing our health and safety policies all the time. We should be reviewing that. And in terms of the induction training for staff, what I would say as well is that a lot of people are nervous about coming back to the office, so at least if everybody understands, you still have those protocols in place. It's not just a free for all. We're not just opening the doors and letting everybody run in. That companies are still cognizant of the fact that there is a virus still going on. You still have your vaccinations. You still have not your vaccination status. That's illegal. You still have your hand sanitizing stations. You still have your hand sanitizing stations. You're still you still have your work representative. You still have your health and safety policies in case there is a case. So just one question here. If someone in the office tests positive for COVID, are you allowed to advise other employees who are close contacts that this person is positive, or would that not be a breach of their personal info, Jennifer?
Well, under GDPR, you wouldn't be able to disclose who the member on their team is.
Yeah.
Exactly, just basically that someone in their, whether it's their team or their area, has tested positive for COVID-19, and they should go home and they should follow the guidelines then as to what there is around close contact there. But absolutely not, under GDPR you can't disclose who the employee is or even what their role might be. So I know some employees might have obviously, like, they get extremely stressed under these kind of situations. I know they might ask questions, but you really need to maintain that and I don't know why I chose to say this word because it's hard to say, anonymity of the employee, and so it's still important to protect them and their privacy.
Yeah, and this is actually a lovely question. If you have if having a policy where employees are encouraged to take the vaccine, I think it would be good guidance as well to encourage staff to. Oh, Jennifer, you moved that question. I think it would be good guidance as well to encourage staff to look at boosting their immune systems. This would be from health and safety and health and wellness perspective. What are your thoughts? So I totally agree with you. And one of the things that we've done here internally into HRLocker, if we've actually introduced it's an app called Whitecam, and it looks at different you can contact nutritionists, or there's kind of different live yoga classes or exercise classes, things like that, and different ways to remain healthy. So that was one of the things that we decided to do as the company. Is, you know, sometimes you can just be too focused on COVID, and let's look at from a broader sense, is that, you know, let's look at the entire well-being of employees, and that's something that's been, I suppose, received very well from our own employees. Jennifer, I don't know what your thoughts are.
Yeah, no, I completely agree with that. And like, internally, we'd be looking at having a well-being policy, which is something that I know multiple companies do have, but some don't. But I do think it is good to have, like, let's say at lunchtime, to have like a nutritionist come in and speak to employees about things, or do it over Zoom and things like that, just little things. And internally as well, we're looking as well at our employee engagement now for all of this year, because people have decided, oh, do you know what, my health is so important to me now after everything. Can we look at doing yoga classes and different things like that? People's perspectives have completely changed over the past 2 years, and health is becoming more at the forefront. So I completely agree with that. I think that's something that employers should definitely be looking at now going forward to help keep their employees healthy going forward.
Yeah, I would agree. So I'm just conscious of time here, so we'll just kind of I'll fly through this one. Is, so in terms of the pause and redundancy, obviously, so this was introduced when some companies, I suppose, were closing their doors because they had been shut down, in fact, by the government. So that pause has been lifted from the 30th of September 2021. Now, for employees who maybe have had a 4 or 5 month break, there is an extra I think it's up to €1,800 that they can claim from the government. But in terms of, unfortunately, if you are in a position that you're looking to make people redundant, then that pause has been lifted. So you can take those steps if appropriate. So future HR updates. So Jennifer, what are we looking at?
So first up is the Statutory Sick Pay scheme, which I think everyone is waiting away for. And as we all know, there is currently no statutory obligation on employers to pay employees who are sick, whether it's for short term or long term. It's been entirely up to the employer. But this discretion will be removed by the enactment of the sick leave bill, which we're hoping will come into law at some stage in 2022. It's been communicated now that it'll hopefully be before the summertime, because the terms and conditions of the scheme need to be confirmed. But basically the keynotes that we do know about the scheme is that initially an employee will be entitled up to 3 statutory sick leave days per year. But the bill provides that employees will eventually be entitled to 10 days of sick pay per year. The SSP will be capped, and the employer will only be obliged to pay up to 70% of wages, which is subject to a cap of €110 per day. The government will not top up the employer's contribution to 100%, which is important to note. There was a bit of confusion about that. And employees will have to have at least 13 weeks of continuous service to be eligible for the SSP scheme. And employees will be obliged, to provide a medical cert in respect of each day of statutory sick leave as well. So keeping those records is going to be a major thing. And if an employer maintains that it cannot afford to discharge its SSP obligations, an exemption may be granted by the Labour Court in that instance. But it is important to note that if you, as the employer, that you already provide more favourable sick leave benefits to employee, you're not obliged to comply with the SSP rules. This will be for employers who may have less favourable sick leave benefits for their employees. It's to make sure that everything is available to the employee and it's fair for them as well. So what employers should do now, because obviously it hasn't come into law yet, is that it will be prudent for employers, especially small employers, to start financially planning now to ensure that they are ready for when the SSP is introduced. So they should also review their existing sick pay schemes or policies to check whether the new rules will affect or change what they currently have in place. And then next we move on to the gender pay gap reporting. And the Gender Pay Gap and Information Act was signed into law in last year, and it is going to apply from a date in 2022, which again hasn't been specified yet. But it will oblige employers to report on the gender pay gap in their companies. And so the employer will have to report on the mean and median gender pay gap, the mean and median bonus pay gap, the mean and median gender pay gap of part-time employees also, and the percentage of male and female employees who receive bonuses and benefits in kind. So employers will be required to include a narrative alongside the figures that they provide, but the details of the methodology and how the information will be reported is still unknown. So we're still waiting for that to be defined. And these details and others will be addressed by the government when there is further developments in relation to that. But Christelle, I do believe that HRLocker has a gender pay gap requirements document available online.
Yep, so we can send those, the 2 links. So we actually have 2 things. One, if you really want to read a report in regards to a survey that we did a few weeks ago in regards to the gender pay gap reporting in Ireland and the UK. And then as well, we have the of how to actually calculate the gender pay gap. And I think specifically, Jennifer, what you've gone through is the key. It's not just a case of male versus female who's getting paid more. There's a little bit more to it than that.
Exactly. So then we're going to move on to the right to request remote working, which I have mentioned various times throughout this, and I've probably been a bit vague about certain parts, but as I said, this is underway, and it is a development which is part of the Work-Life Balance Directive, which, as Christelle mentioned at the beginning, must be transposed into Irish law by August 2022. So here's hoping long before then we'll have this. But basically the purpose of this is going to be to provide every employee with children up to 8 years of age and carers the right to request flexible working arrangements. And this remote working legislation will further support an employee's work-life balance, which is going to be fantastic. But the directive also gives member states discretion to legislate around the duration of flexible working arrangements, and it provides that employers should be able to decide whether to accept or refuse a worker's request. So what that essentially means is that while it's called the right to request remote working, it's not an absolute right to request it. Some employers aren't going to be obliged to accept every request that they get. There is going to be circumstances where it isn't possible, which I'm going to go through next, as these are ones that Leo announced yesterday. But it is important to note that it isn't an absolute right for employees to avail of this, which I just can't stress enough. But if we pop over to the next slide there, I'm going to go through the specifics of what was announced by Leo yesterday. So he gave us some more specifics about the legislation which is going to be coming in and what circumstances employers can refuse requests. So the specifics that he went over were that an employee must have at least 6 months service to be able to submit a request, and the employer will have 12 weeks to reply to that request. Now, the employer can counter offer the employee's request, and the employee will have 1 month to either accept or refuse that counter offer. There will be a right of appeal to the strategy, and this will be dealt with either internally or through the WRC. And an employee can actually submit another request after 12 weeks as well. And then lastly, he stated that a requirement of this strategy will be that all employers must have a work from home policy in place. We at Bright Contracts, we would have had a temporary working from home policy at the beginning of when all of that guidance was coming out, which is updated to be a work from home policy as well. Again, like all the other policies, it is completely editable and it's going to be in the handbook. But what Leo was saying is that all employers must have this policy in place before being able to have these requests. So that will be something that I would suggest that employers look at implementing in advance of this coming in. As for the conditions under which an employer can refuse an employee's request under the legislation, now there was a bit more, a few more than what I'm going to go through now, but I'm conscious of the time here. But the most important ones anyway, and the ones that I think will be most relevant to employers, are that an employer can refuse if it's due to the potential negative impact on performance, if the nature of the work just simply doesn't allow the work to be done remotely, if the employer cannot reorganize work among their existing staff. A big one as well, which I have found with some customers when speaking with them, is the concerns over internet connectivity of the proposed remote working location. As we all know, some areas can be worse than others for your internet connectivity, so that actually is an important one there. And then we have the potential negative impact on quality, and the concerns about the suitability of the proposed workspace on health and safety grounds, which we obviously touched on earlier. And then if there is an ongoing or recently concluded formal disciplinary process as well. So it is expected that this legislation will completely cover all of the grounds for being able to refuse requests. I'm sure there probably will be more than what was announced yesterday. But all of the terms and conditions will be transcribed into the bill, and whenever we get further information and guidance about that, we at Bright Contracts would be updating it across our software, obviously, but also we like to communicate it across our blogs and social medias and newsletters as well, just to make sure that everyone is informed and they can keep on top of things and be fully compliant as well.
Absolutely. So I'm just conscious of time, so I'm just going to fly through this, because everybody's going to get a copy of these slides. So in terms of the budget update for 2022, the national minimum wage has increased, maternity and parental leave payments to be increased as well. So just something to note if you're paying that as an employer. The parents' benefit has gone from 2 weeks to 7. The employment wage subsidy currently at the moment, it's up to the 30th of April 22. And there's been some changes to how people who are working remotely can claim in terms of income tax. So for ourselves here, what we like to do is just communicate out to employees in terms of just to make, because we have a lot of remote workers, to make sure that they're actually claiming that tax benefit as well. So
sorry, Christelle, I just wanted to touch on that there, because I know some people might have maybe seen the first slide where we spoke about parents' benefit and seen the 5 weeks and thought maybe it was incorrect. It absolutely is not. I just wanted to make sure that everyone knows that it is still currently at 5 weeks, but it will go to 7 from July. So that will obviously be communicated to people as well. But as it stands, it is correct that it is at the 5 weeks. Yeah. Thank you.
So what I'm going to do real quick is I'm going to fly through some of these questions and hopefully I get to all of them. Jennifer, if I allow one employee, this is like this quick fire round. So if I allow one employee work 100% from home, but in general, I want other employees to come into the office 2 or 3 days a week, am I leaving myself open to discrimination?
That is a tricky one, and basically what our advice has been to people is that, as I kind of mentioned before, when it comes to hybrid working arrangements, it is looking at each individual person's circumstances. If the employee that you're allowing to work from home, if there's certain circumstances, whether it's around health and safety and things like that, once you have that justification as to why there is the difference in one employee to other employees, you will be covered on that basis. But having that justification will be so important. It can't be seen as basically being favourable to one employee over another. That's what you want to avoid as the employer. You want to be seen as being a fair and equal opportunities employer. So just looking at those individual cases and then making the criteria, I suppose, around why certain employees will be at home and others will be in the office. So just clearly defining that.
Yeah. And Jennifer, if an employee has worked full time from the office throughout the COVID situation for the last year, do we have to now let them work from home? So no, once the government guidelines have been lifted, it's something that now you need to review and make sure that you're communicating with that employee of what your expectations are. And obviously they will have the right to request to work from home, and then you can reevaluate it then, Jennifer.
Exactly. Yeah, no, I completely agree.
Okay. Sorry, now I just want to get back to where I was. My apologies. We're offering a phased return to work with hybrid option of 40% home with 60% office policy. What are your thoughts? So I think a lot of companies are going with the same. Jennifer, what do you think?
Yeah, I agree. I don't think there's going to be many businesses who are looking to bring back 100% capacity. I think over the last 2 years, companies have seen how well home working can work. And I suppose I think that that's probably actually a very fair thing to have in your business is the 60-40. And I do think that will be something that an awful lot of businesses will adapt, because they realize as well that employees need to have that work-life balance, and most weren't achieving that prior to COVID by coming into the office and working 5 days a week. They were missing certain things, or they were overworking themselves and things like that. So it's a good way to ensure that your employees are getting that work-life balance. So I think that's really great that that company is implementing that.
I think so. If employees are on lower pay and can't afford to pay to get a sick cert, how would this work? So I suppose really that's up to the company to deal with if they're happy to cover the sick pay for that, right?
Yes, exactly. Like some companies would have that they'd have a company doctor, and they might choose to send an employee to that company doctor, and that will be covered by the company, but that's entirely the company's choice. There's no yeah, exactly. Yeah.
Let's say there were 2 or more unvaccinated employees. One brought COVID to the office from the one other unvaccinated person got seriously sick. Could the employer be accused of lack of care to its employees for allowing the virus into the building and putting the life of one of its employees in danger of death? So currently, right now, it states no, in terms of your duty of care does not extend that far, Jennifer.
No, it will be entirely different if the employer knew that the employee had COVID. Then obviously there would be reasons for a case there. But if it was unknown to them, there's nothing that the employer can do. And in that case, I think what you said there is absolutely correct. Yeah.
When do you expect the sick pay changes? So this is actually $1 million question because it was supposed to come in a while ago. So we are somewhat expecting.
We're waiting just as much as everybody else.
So the question is Q1. I would say no. I would say probably Q2 at this stage, Jennifer. But you know,
I think even Q2 probably it might not be. Unfortunately, we're all hoping for Q2. But,
is the right to request to work remotely in effect now or coming in later in the year? So it is coming in. Yeah.
Yes, it's coming in. Yes, there's nothing. There's nothing put in now that people can request for it. It's what is due to come in the year. Yeah.
So, and I'm just going to clarify this one. So the remote working request is only for people with kids under 8 or carers, or is that the work-life balance directive? So my understanding, the work-life balance directive, that's the concentration. So the remote working request will be for everybody.
Correct.
Okay. Can you explain about this 30% deduction on vouched expenses, please? So that's purely just employees when they're doing their their tax return, right?
I'll be very honest. When it comes to the payroll side of things, I'm strictly all legislation. When it comes to payroll, that's my dicey area.
Yeah, no, I think it's just when you're doing your own tax return. So in relation to employees being able to refuse to take a test, does this still apply to those working in healthcare? So my understanding under data protection, under what the Data Protection Commissioner has currently released, and this was probably about 6 months ago, Jennifer, is that it's in regards to the vaccination status. It's not regarding to the testing status.
Yes, correct.
Yeah, and that's what we would be working off of. Is providing COVID induction training necessary, or can you just provide the employee with the information related to that? And is it a legal requirement or just by individual company? So it's currently what's recommended in the back to work protocol.
Yes, exactly. Yeah.
Yeah, and I mean it depends on what your training you require. So we have here we do have a little online presentation and a bit of a kind of a PowerPoint presentation that we would send out to everybody as well. And we have in HRLocker we have kind of a CPD section where they would review it and sign that they have it, and we get people to do it continuously. But it's not a legal requirement, but I would recommend it. Jennifer, I don't know about yourself.
Yeah, no, I completely agree. Like some companies as well, they may have added it to, they may have had like a learning and development system as well, and they may have uploaded their induction there as well. And similar to what you had said there, Christelle, they'd get let's say a certificate at the end, stating that they attended the training, or it's signed off that they've done the training, things like that. So I still think it's extremely important to ensure that you do that with any incoming employees, it's the same importance as it was a few months ago.
Yeah. So we're going to do the last two questions, and then if I have missed a question, my apologies, I'll go through them to make sure that I've gone through them and make sure to get somebody to contact you. So for this one, I'm going to push it such a small bit but for a GP practice, a lot of confidential information would be part of the job. What would you require there to maintain GDPR? A workspace that is closed door, locked cabinet for any paperwork? Any thoughts would be welcome. So what I would actually recommend there, Jennifer, is that they maybe look at a consultant to come in and recommend on how they facilitate that remote working. What would your thoughts?
Yes, I'd agree with that. Yeah, especially with the volume of personal information that a GP practice would have, I think that will be the best guidance. Yes.
Yeah, especially if they're working under some kind of ISO ruling or something like that, that maybe that consultant can give them some better advice than what I would do, unfortunately. And then my very last question, which we can answer, is if you're off sick for 1 day with a bug, do you still need a doctor's cert for your employer?
No, in my opinion, no. We all surprisingly managed to get bugs that isn't COVID.
Yes.
I think that's shocked an awful lot of people for this year. But no, but it is really down to whatever the employer has in their sick leave policy. I don't know what your company may have in it, but everyone gets sick. Everybody's human. We all have a day where we have a bug or a cold, things like that. I personally don't think that there's a requirement to have a sick cert for that if they've just missed 1 day. If it was a case that the person was out for 3 days, that's where internally anyway, our sick leave policy, we'd have that you get a sick cert. But if it's just 1 day, my understanding would be that it would just be put down as a sick day, and as to whether it gets paid or if it's unpaid under your company's policy, that's under that. But no would be my answer to that.
And I mean, in that kind of thing, I think it's important is that you're talking about what I'm answering that question to is that if there's one case, whereas if that person has been out 20 times that year, that's a little bit different.
Yes, exactly. Yeah,
you might want to deal with that on an individual basis, but if it's just one person who's been out sick because they've got a bit of a tummy bug for 1 day, then I wouldn't require a cert personally. So thank you so much, everybody, for attending, and thank you so much, Jennifer. You've been super in regards to the updates, and I'm hoping that we've answered everybody's questions. And apologies for some areas being grey, but that's really just the advice that we're working on at the moment. Some areas are a little bit grey. My advice to companies at this stage, Jennifer, would really be is just to decide what workplace you want. Is it going to be a hybrid or is it going to be remote? And communicate with your employees to make sure everybody's on board.
Yeah, I completely agree. And I just want to say thank you so much for having me on today. And thank you, everybody, for attending and your questions have been fantastic, and it's good to see kind of what customers are thinking at the moment, and what are the thoughts amongst other businesses. So it's a great insight for us to have as well. But yes, basically just communicate to your employees and keep on top of the government guidance. Only look at official sources, and as things get updated, make sure that your policies are updated as a reflection on that as well. So for example, when the sick leave bill comes in, make sure that you look at your own sick leave policy. So it's just going to be keeping on top of things and communicating to your employees. But yeah, thank you so much for having me today. It's been a pleasure.
Super. So as always, everybody will get a copy of the recording and all the documents that we've mentioned as well in terms of downloads. And please, if anybody has any questions, please feel free to contact myself or Jennifer, and we'll try to help you as much as possible. Hopefully be able to color some of that grey a little bit darker, but thank you everybody so much. So take care everyone, and we'll talk to you again soon.
Thank you.